As of Monday of this week, all 11 law enforcement agencies in our region now have a system in place to refer a non-emergency mental health call into 911 to the mobile crisis response team to get that individual the right type of help that they need.
We're learning. We have lessons learned. We are applying them as we move forward. We are very nimble and flexible, and that's how we created the program so we can adjust in the midst to be responsive with our community and our clients, because that's ultimately who we serve, right? The clients. So we will apply those lessons learned and tweak the model where we can and need to be the best program that we can be here in San Diego.
Last year alone, San Diego County law enforcement responded to 38,380 calls for service for mental health related concerns. That's an average of 105 calls for service per day. While the men and women of law enforcement do a tremendous job every day evaluating these calls to bring help to those in need, we realize not all the calls require a law enforcement officer. Our partnership with the county's mobile crisis response team has allowed us to free up valuable law enforcement resources to focus on other areas of public safety.
To highlight one success story of the many calls this far, I will share the one of an individual who had routinely been calling their law enforcement agency with complaints that derived from their mental health symptoms. That agency was able to divert this call to MCRT. We were able to go out and get this individual connected with a crisis stabilization unit, providing them follow-up case management and connecting them with an assertive community treatment program, allowing for these interventions to support the individual in breaking the cycle of unmet care.
When we had the resource in our toolbox now to send a mobile crisis response team instead of law enforcement, for us, we embrace that as dispatchers because yes, it's a change, but it also gives the community an opportunity to have somebody respond that's a licensed clinician. Sometimes when the officers respond, they may not be receptive to someone in a uniform. So now, like Chair Fletcher said, that you have the opportunity to have someone that has the time and the training to be there and spend that extra time with them.